I'm going to teach you an evidence-based skill that can help with impulsivity and emotion regulation, pros and cons, which comes from DBT's distress tolerance module. Hi everyone, I am Dr. Kiki Fehling. I'm a licensed psychologist and expert in dialectical behavior therapy. I actually created this video a few months ago for Now Matters Now, which is a suicide prevention nonprofit completely founded and run by people with lived experience of suicide, substance use, addiction, and various mental health difficulties. If you want to learn more about pros and cons, about DBT, or about Now Matters Now, please check out the links in the video description below. I hope you learn and feel free to leave any questions. Thanks. Usually when we're feeling intense urges or cravings to engage in impulsive behaviors, we are in the middle of emotional crisis, or as we say at Now Matters Now, we're in the red zone, where we're feeling super stressed out or really upset, such that we might feel dissociated, or we'll have racing thoughts or a lot of physiological agitation, and just generally we'll feel overwhelmed. In those situations, it can be really hard to think clearly and to act wisely and to avoid acting impulsively in ways that cause us problems later. So the skill of pros and cons is one of the skills that we use to help ourselves choose skills rather than acting impulsively in those crisis moments. The easiest way to describe how to practice pros and cons is to show you. So I will be doing that by drawing out the type of grid that we use in DBT and at Now Matters Now to practice pros and cons and walking you through how to fill this out. What I will say is pros and cons is easier to do ahead of time. So when you're not in crisis, when you're not feeling upset, when you're feeling calm, cool, collected, and you can think clearly about all the things that are important to you. So doing pros and cons ahead of time so that you have it written out for you to read or just remember when you're in the middle of crisis. For now, we can get into what it looks like to actually write out pros and cons of impulsive behaviors. Okay, so to practice pros and cons, you want to make a grid on a piece of paper that has 4 zones or 4 quadrants. There's basically 2 columns that you label pros and cons, and then 2 rows that you label like option 1 and option 2, where option 1 is engaging in the impulsive behavior, and you can write specifically what you mean by that for you. And option 2 is avoiding acting on the impulsive behavior. So doing whatever you would need to do coping skill-wise to make that happen. Just not doing the self-destructive behavior. Each of these quadrants has a different question that you want to answer. So quadrant 1, what positive things or wanted things would happen if I went with option 1? Meaning, if I acted impulsively, what would I get out of it that would make me happy? So really common ones are usually quick emotional relief, feeling good rather than bad, feeling something rather than nothing, or maybe getting care or attention from somebody else. Quadrant 2, the cons of the impulsive behavior. You want to answer the question, what are the negative or unwanted things that I think would happen if I went with option 1, aka doing the impulsive behavior? So maybe engaging in impulsive behavior would cause relationship issues or conflict. Maybe you'd feel guilt or shame about it. Maybe you'd get punished or lose something important to you. Maybe you'd have to hide scars or something like that. Whatever the negative or unwanted things, you want to write them here about the impulsive behavior. Quadrant 3, you want to answer the same question as quadrant 1, but this time for avoiding impulsive behaviors. What are the positive or wanted things that you would get if you avoided acting on the impulsive behavior? So you can think about feeling pride or competent or confident in what you did. Maybe it would offer you time to try new coping skills, which is important to you. Or maybe a loved one would be really pleased or happy or proud of you. Those are all positive things you might get from avoiding acting on the impulsive urge. Finally, quadrant 4 is what are the cons of avoiding the impulsive urge? What are the negative or unwanted things that would happen if you avoided acting on the self-destructive urge? So often this one is just it's harder than engaging in the impulsive behavior. It might take more time to feel better. It might require more effort to feel better. Maybe you'd have to feel painful emotions for longer or more intensity than you would have if you had to use the impulsive behavior. So whatever it is, that's a con of avoiding, that's what goes here. For all 4 quadrants, you want to make sure that you are considering both short-term and long-term consequences. So a lot of times when we are struggling with self-destructive urges that help us feel better fast, we really focus on short-term consequences like feel better now, while avoiding the long-term consequences like someone finding out in a few days and then getting upset with you. So when going through pros and cons, you want to make sure that you're talking about both of those things. Once you go through all of your pros and cons for both options, you then want to think about, okay, out of all of these things I've listed, what are the 1, 2, or 3 things that are most important to me? So think about, it might be, yeah, I want to feel better fast, but I really don't want to hurt myself in this way anymore. It's important to me to keep this commitment. So you circle the 1, 2, or 3 things that are most important to you, and then there you go. When you are in crisis, you can come back to this sheet and really narrow down to like, okay, what are the reasons that I can validate I want to engage in this impulsive behavior right now? It makes me feel better. It gets me care and support. But what are the things and the reasons why I don't want to do this right now? It's important to me. I want to avoid conflict. I want to feel proud of myself. And seeing it all written out and highlighted, what's most important to you, can help you in those crisis moments access wise mind and act the way that you most want to act. Put this in your distress tolerance kit. Come back to it repeatedly as much as you need to. After different types of crises, you might add pros and cons in the different quadrants. And then make sure that you do pros and cons differently for each different impulsive behavior that you struggle with. There are different pros and cons for different behaviors. Hopefully that was helpful, and this can help you the next time that you're feeling overwhelmed and feeling the urges to engage in impulsive or self-destructive behaviors.